Morning and welcome back, everyone. I'm Jim Trovato, Professor Vice Chair, Academic Affairs at the School of Pharmacy. So my goal during this 1 hour and about 15-minute educational session is to introduce you to proven teaching and learning strategies that you can apply to your educational activities in both the classroom and experiential setting. So I just want to make a note that this presentation, I feel these strategies that I'm going to talk about are really applicable to all of us as learners, whether we're students, residents, fellows, preceptors, faculty. We will benefit from these strategies that will be presented. Now, in addition, there will be 2 breakout sessions, about 10 minutes each, where you'll be asked to pick one of the strategies that has been presented and brainstorm within your group. And I'm going to ask you to just to select the groups that you were already assigned to earlier today with the team-based learning exercise. So you'll be asked to strategize or brainstorm within your group about how you would use a strategy in your teaching environment. And then you'll be asked to share the outcome of your brainstorming session. And maybe I will be able to advance the slide. Yay. Okay, so at the conclusion of this activity, participants should be able to describe 10 proven teaching and learning strategies, cite specific examples for these strategies, and discuss again how these strategies can be applied to your learning environment, your teaching environment. Here are the 10 evidence-based teaching and learning strategies that would be covered during this presentation. As an instructor and or preceptor, these strategies will aid you to effectively implement educational methodologies, assessments, and provide feedback to your learners. These strategies are designed to enhance the long-term memory and retention of knowledge and skills for yourself or for your students. So I thought this quote was applicable from Herman Simon. He's one of the founders of the field of cognitive science and also a Nobel laureate. His quote, "Learning results from what the student does and thinks, and only from what the student does and thinks. The teacher can advance learning only by influencing what the student does to learn." So my hope is that the teaching and learning strategies that will be discussed, presented today, will be tools that you can use to influence what the student does learn. As we teach, we often try to enhance our students' understanding of the course content by connecting to their knowledge and experiences from earlier in the same course, maybe from previous courses, or from everyday life. All new learning is built on a store of prior knowledge. We interpret and remember events by building connections to what we already know. So students come to you with knowledge, beliefs, and attitudes gained in, again, other courses, from their work life experiences. And this can influence how they filter and interpret what they are learning in your course or experiential rotation. Prior knowledge involves the transfer of available knowledge from long-term memory to working memory and results in higher recall and better understanding of new information, which ultimately has a strong positive impact on student learning. Now, one caveat is that students' prior knowledge could potentially hinder learning. Although as instructors we can and should build on students' prior knowledge, it's also important to recognize that not all prior knowledge provides an equally solid foundation for new learning, or we may overestimate students' prior knowledge and thus build on knowledge, and thus build on new knowledge that's on a shaky foundation. So prior knowledge only helps learning when it is activated, and we'll talk about that next, when it's sufficient, appropriate, and accurate. So I'm sure we're all guilty, or at least I've been guilty, of teaching some concept or skill and not taking the time to ask students what they already know about the topic and make important connections to what is to come. Understanding what students know or think they know coming into your course, lecture, or experiential rotation can help you design your instruction more appropriately. This will allow you not only to leverage the student's accurate knowledge more effectively to promote learning, but also to identify and fill gaps, recognize when students are applying what they know inappropriately, and actively work to connect misconceptions. I feel one simple approach is to talk with your colleagues about knowledge and skills that they have taught your students earlier from prior courses or even within your own course. Ask your colleagues about what students bring to your course or educational setting. It's important to ask yourself, what knowledge or skills is the student expected to have prior to participating in your lecture or other learning activity or your rotation? This information can be used to help you modify your instruction and to better meet your students' needs. So during your lecture or instructional activity, you can use minor prompts, simple reminders to indicate when and where students have heard the content before. You can collect baseline data on students' understanding of content in your course by giving a baseline assessment in the form of a quiz or instructional activity in the lab or on rotation. You can use the think, pair, share technique, asking students to generate relevant knowledge from previous courses or their own lives. You can ask students to self-assess their own prior knowledge by, one, creating a list of concepts and skills that you expect them to have coming into your course. And some concept skills you expect them to acquire. Typically, these are linked to the course, your course objectives or activity learning objectives. And then using a Likert scale ranging from very poor to very good, you could ask the students to rate their knowledge or their on this concept or this skill. So for example, how would you rate your ability to describe the key differences between benign and malignant tumors? And then they can use a Likert scale, to, very poor to poor to fair to good to very good to then rank that. Finally, you could assign a concept map or mind mapping activity to discover what preconceptions or prior knowledge students bring to a topic. A concept map can be used to introduce a topic, finding out what students already know, and providing a framework for studying the topic. And this is something that could be organized by you as the instructor. It could be in collaboration with your students, or it could just be something that's done by the students on their own. This slide is showing you an example of a concept map. So to gain insights into what your students know about a given subject, you're asking students to construct this concept map representing everything they know about the topic. In this example, cancer is a topic or central idea. You can prepare a list of subtopics, things like signs and symptoms, causes, and give each pair or small group of students a set of keywords for each subtopic, and then have them complete the mind map or concept map. Alternatively, you can just give them the topics, the central idea, excuse me, you can just give them the subtopics and then see if they can generate the keywords on their own. Afterwards, it is important to have a discussion with students to clarify their understanding of the concepts. Let's turn now to metacognition. Metacognition is what we know about what we know. It includes a critical awareness of one's thinking and learning and oneself as a thinker and learner. So metacognitive practices help students become aware of their strengths and weaknesses as learners, test takers, group members, and so forth. A key element of metacognition is having the student recognize the limit of their knowledge or ability to perform a task, and then figuring out how to expand that knowledge or extend that ability. So I think really that's a key takeaway point to understand about metacognition or using metacognition techniques, again, is allowing the student to recognize the limit of their knowledge or ability to perform a task. And then again, figuring out how to expand that knowledge or extend that ability. So for example, it's been shown that students that don't quiz themselves tend to overestimate how well they have mastered the class material. Metacognitive practice increase students' ability to transfer or adapt their learning to new contexts and tasks. So in short, if people lack the skills to produce correct answers, they're also cursed with the inability to know when their answers or anyone else's are right or wrong. Research does suggest that increased metacognitive abilities, so to learn specific and correct skills, how to recognize them and how to practice them is needed to become a better learner. By the way, I'm monitoring the chat box. If you do have questions, please feel free to unmute yourself, ask a question, drop something in the chat box. We can certainly make this interactive. So this slide here is showing you some examples, activities to promote student metacognition in the classroom and experiential settings. Exam reviews, examinations themselves can be a metacognitive method. During the exam review, have students reflect on their answer choice and the actual correct answer. Ask them to reflect on why they got the item incorrect and specifically why this occurred. Ask prompting questions such as, what are your assumptions about this question? What are some alternative ways to approach the question? What piece of knowledge were you missing? So by forcing learners to identify the problem in their thought process, you might be able to identify patterns of incorrect thinking or gaps in preparation and study time to offer strategies to the student to remedy this. We can also use metacognitive questionnaires, which include creating checklists, rating scales, and rubrics for distribution before an assignment to help students monitor and evaluate their thinking as they are working. This is something that we do extensively in our Abilities Lab courses at the School of Pharmacy, where we provide rubrics that students use during their practice lab sessions for activities like sterile compounding or IV product verification. So additionally, administering a metacognitive questionnaire after the exam can help learners evaluate their thinking. So for example, ask students to select up to 5 questions that they feel certain they answered incorrectly and tell why they think that was the case. Maybe the question was confusing or difficult to understand, or maybe the student simply wasn't prepared to answer that question. We can also ask students to reflect using the muddiest point. So simply allow the learners to identify confusing areas during the lecture or learning activity. Have the learners write down what part of the material remains confusing to them. Then have the learner investigate the issue further to encourage exploration of knowledge and self-directed learning. Now, in the experiential setting, one application, do you think, I think we have a question coming up here, do you think using something like the muddiest point is helpful on more of a weekly basis or after each lecture? I think to answer your question, I think both can be useful. I think that this will depend on how you break up your lecture, how you break up your learning activity, and something we'll talk about in a minute, spacing. So I think that if you're introducing new material on a weekly basis, then yes, I think then you can introduce the muddiest point as well. So hopefully that answers your question. If not, you can always contact me afterwards and I'm happy to elaborate on that. So again, in the experiential setting, one application of metacognition is mastery goal set, which is aimed at attaining a standard of competence defined by self-improvement or skill development. So when students have mastery approach goals, they strive to master and know the tasks they are working on. They are motivated to learn in order to improve their knowledge and attitudes. So, another way to look at this is that students have a self-motivated mindset. So an example would be is that a student's walking into your class or walking into your rotation and they say, I want to learn as much as possible from this experience, right? It happens all the time. Questioning and feedback is another way preceptors can help their students on rotation by emphasizing metacognitive skills from the beginning of training, combined with immediate feedback regarding the technique. So these are questions that preceptors can regularly ask students to promote metacognitive awareness, including questions related to planning, monitoring, and evaluating. So for example, asking students, what did you learn about yourself today regarding preparing for patient care rounds? What did you learn that you can consistently replicate well? Asking these types of questions increases students' metacognitive awareness. Based on these results, preceptors can ask students more specific questions centered around planning, such as, how did planning for rounds today help you manage your patients? Or questions regarding their monitoring. How did you prioritize what information you needed to cover with the patient for the discharge med rec? And finally, evaluating questions such as, how well are you recalling and applying your knowledge from the didactic curriculum to this rotation experience? And what could you do to improve? Now, I probably don't have to tell you this, but questioning should be Socratic and developmental compared to evaluative and demeaning. So to effectively ask questions, precepts should do the following. Determine what level your student's at. You deal with P2 students versus P4 students, and to teach at that level. Avoid asking non-meaningful questions, such as trivia questions, historical facts, or the famous guess what I'm thinking questions. Tell learners your goal in asking questions. Emphasize the important learning points, and do not attempt to embarrass or intentionally humiliate the learners. Okay, I promise I haven't been drinking. Lastly, metacognition is modeled with clinical documentation and explanation. So written and verbal communication required an explanation of the thought process of your student. So for example, if you're making a recommendation, if your student's making a recommendation to a physician for a specific drug, you should explain why you chose that drug. Was it maybe related to a drug allergy, to another drug, adverse effects, and so forth? But by explicitly documenting and reasoning, metacognition is modeled and could lead to better communication and patient outcomes. Another example is SOAP notes. You may want to ask your students to include an additional page that documents the rationalization and resources used to arrive at the plan. Some additional tips is to teach students how their brains are wired for growth. The belief that students adopt about learning in their own brains will affect their performance. Research shows that when students develop a growth mindset versus a fixed mindset, they're more likely to engage in reflective thinking about how they learn and grow. Give students practice recognizing what they do not understand. The act of being confused and identifying one's lack of understanding is an important part of developing self-awareness. Take the time at the end of a challenging task or class to ask students, what was most confusing about the material we explored today? Kind of getting back to the muddiest point. Provide opportunities to reflect on the coursework. Higher order thinking skills are fostered as students learn to recognize their own cognitive growth. And this was something that Dr. Knoll had alluded to in his presentation. But questions that help this process might include, before this lecture, I thought cancers were caused by blank. Have the students fill out the blank. Now I understand cancers to be the result of blank. How has my thinking about environmental carcinogens changed since taking this lecture? So have students keep personal, another option is having students keep personal learning journals to monitor their own thinking. Assign weekly questions that help students reflect on how rather than what they learned. So these questions might include things like, what was easiest for me to learn this week? What was most challenging? What study strategies work well as I prepared for my exam? What will I do differently next time? Another thing is to consider essay as an alternative to multiple choice questions. Research does show that students use lower level thinking skills to prepare for multiple choice exams and higher level metacognitive skills to prepare for essay exams. Now, I know this may not always be practical, and certainly it is less time consuming to grade multiple choice questions. But even the addition of several short essay questions, so you can, pepper the quiz to have one or two short answer, this will certainly improve the way that students reflect on their learning to prepare for test taking. So another strategy I'd like to introduce is one called retrieval practice. Retrieval practice is a learning strategy that involves recalling facts or concepts or events from memory. So the use of flashcards for studying is a simple example. Deliberately recalling information forces us to pull our knowledge out and examine what we know. When trying to recall information, we exercise or strengthen our memory. We enhance and boost learning and recalling information, as well as interrupting forgetting. So it's been shown that, as an example, a single quiz after reading a text or hearing a lecture produces better learning and remembering than rereading the text or reviewing lecture notes. And this is, this connects to effective study habits, something that was taught by Dr. Reed in his course, something that's now being taught by Dr. Knoll. So there is evidence out there about effective study habits, and you as an instructor, you as a preceptor, it's important to instill and remind your students about these effective strategies. The more cognitive effort that is required for retrieval, the greater the retention. So because retrieving information requires mental effort, we often think we're doing poorly if we can't remember something. We may feel like the progress is slow, or that, but it's important to remember that it's at this point that the learning takes place, that our best learning takes place. The more difficult the retrieval practice, the better it is for long-term learning. So again, getting back to essays, short answer tests, or simply practice with flashcards are more effective than, say, multiple choice or true false. However, multiple choice tests still generate strong benefits. So I'm not trying to, I was going to say demoral, but to minimize the benefits. It's just that some may be more effective. So this part of what makes the RAT process the valuable learning activity is team-based learning. Retrieval practice is a powerful learning tool. Yes, thank you, Dr. Knoll, for reinforcing and bringing that up. So the use of testing, again, should be looked at as a tool for learning. In all areas of learning, you build better mastery when you use testing as a tool to identify and bring up your areas of weakness. And that's what you need to tell students. So when using retrieval practice or testing in your class or an online instruction or rotation, it should be low stakes, not count actually towards the grade or a large percentage of the grade. It should be regular and frequent. So oftentimes, given a quiz at the start of your lecture, maybe based on pre-class reading or assignments, a second quiz at the end of the lecture or class, given a review quiz, a day or so before a final examination. So quizzes work best to enhance long-term memory when they are delayed, meaning that you don't give it immediately after the study. Alternatively, you can incorporate multiple choice questions into presentation slides. That's something that I'm not doing now during my presentation. Have students use clickers or poll everywhere. I know some of you had experiences with this with pharmacotherapy rounds, or or even as a student. But you can ask the audience to submit their answer choice, and this allows you for immediate feedback, to reveal correct answers, and help to facilitate further discussion or study. Now, the benefits of regular, frequent, low-stakes testing include improving students' class attendance, increase in studying before class, and students know there will be a quiz, increase in students' attention during class, especially if students are tested at the end of class, and enable students to better calibrate what they know and where they need to brush up. It does decrease test anxiety among students, and finally allows you as instructors to identify gaps in students' understanding and adapt their instruction to fill them. Now let's take a look at two other strategies, space practice and interleaving. I've combined these together because they really go hand in hand. But space practice and interleaving are two learning strategies that have proven effective to embed new knowledge and skills into our long-term memory. And then, of course, having them readily available from memory so that you can, or your students can, make sense of future problems and to tackle future tasks. Space practice, also known as distributed practice, involves spacing learning over time. The learners retrieve and are using information over time, as opposed to a mass practice, or like cramming, where all the retrieval or practice occurs in a short period of time. So I'm sure we all have had some experience with this, either ourselves, where you're cramming the night before an examination. Does not work well. So spacing works because it allows forgetting to happen, followed by making the effort to retrieve that somewhat forgotten information. So when successful, the effort leads to learning and has been termed a desirable difficulty. If the retrieval attempt is too easy or even too hard to the point where the learner is unsuccessful in retrieving the information, then spacing is not effective. I came across a study by Tierney and colleagues, it's referenced on the slide, that they did show that spacing quizzes, these were done 2 weeks apart, did improve long-term retention of brand generic names compared to no quizzes, compared to giving no quizzes to students, so meaning that the students just studied alone and that's it. So they didn't have these practice quizzes. So again, given these space quizzes, practice quizzes, was shown to be better than mass practice or no quizzes at all. When I say mass practice, that's simply giving like one quiz immediately after the students study the material. So delayed recall of drug knowledge was greater when multiple practice quizzes were given and spaced in a way so that subsequent practice quizzes occurred at a period closer to the first quiz as opposed to closer to the final examination. So ultimately, students in your class, for example, or in your course will have a final exam. But again, I think what the research has shown is given these spaced, frequent practice quizzes is going to help with the retention in their long-term memory. Now, some examples of using spaced practice in the classroom include breaking up lessons into smaller sessions. And I'm just going to pop back here a little bit more. I was talking about the study by Tierney and colleagues. And you know what? I got so excited that I forgot to talk a little bit more about interleaving, which I grouped together. But interleaving 2 or more subjects during retrieval practice also provides a form of spacing. If students interleave the study of different topics, they learn each better than if they had studied them one at a time in sequence. So for example, having students practice calculation problems that are a mix or interleave, such as ratio problems, proportion, dimensional analysis, rather than clustering by problem type. Now, one challenge is that learning from interleave practice does feel slower and students cannot easily see the long-term benefits. So students may become frustrated since they will not have mastered one topic or one type of problem and then be forced to switch to a different topic or problem. However, research does show that mastery and long-term retention are much better if you interleave practice compared to, again, the mass practice. Questions, problems on final exams or even standardized exams are unpredictable. We're not sure what we're going to get on that NAPLEX. So they could be mixed up, they may be out of sequence. So when you learn under conditions of mass or block repetition, you have no practice on that critical sorting process. Interleaving helps students to better learn how to assess the context of a question, discriminate between different problem types, and help to select and apply the correct solution from a range of possibilities. All right, now we can move on. So the last slide here before we break out is some examples of using spaced practice in the classroom include breaking up your lesson into smaller sessions. Instead of teaching a topic using one long lecture, divide up the lecture into smaller lessons and space them over multiple days, if possible. This may be easily done asynchronously versus synchronously. You can have cumulative cases, quizzes, and exams that will require students to maintain proficiency with information they have learned earlier in the course. So cumulative retrieval practice involves spacing by including concepts learned from earlier points in the course. It also encourages students to review previously learned information in order to prepare for the exam. Another idea is to provide students with in-class opportunities to retrieve information from previous classes with activating prior knowledge by combining spaced practice with retrieval practice. So for example, at the beginning of the class, give a quick 1 to 5 question quiz on the, in the first 5 minutes of your lecture that include questions from the last lecture, from last week, or and maybe one question from last month. So where possible, try to select past exam questions that relate to the current topic in some way. A lighter approach to introducing spaced practice is to give students an opportunity to practice the information you've taught later, for example, by implementing lagged homework. In this way, homework is given on a topic weeks after the topic is taught. Now, in the experiential setting, you can use space patient cases, whereas case scenarios and clinical questions are distributed weekly and can significantly improve students' retention of clinical knowledge. Another option is revisiting prior rotations by using retrieval practices, exercises, or assessments addressing knowledge and patient care skills from students from previous rotations. I find that this especially works well with students participating in a clinical track program, whereas they have multiple and different patient care rotations at the same institution. How much spacing is enough? The more the better. Space practice is beneficial whether the lectures or learning activities occur on consecutive days, 1 week apart, several weeks apart. Research shows that spacing is better than no space, and exactly how much time should occur between learning sessions is less critical. So again, you as educators, teachers, preceptors, learners should strive to space information across multiple days at long enough intervals that encourage challenging retrieval conditions. Again, these desirable difficulties. But these intervals can be flexible and adjusted according to course schedules and the specific material being learned. Okay, so now we'll have some participation here. Let's go ahead and we're going to break you out into what I'm going to ask you to do is just select the group that you were previously assigned for the team-based learning. And we're going to ask you to brainstorm within your group how you would use, just pick one of the strategies that was presented today, presented just now, and strategize how would you use this in your teaching environment. And then I'll call on you to share the outcome of your brainstorming session. So let's see here.
Jim, do you want me to go ahead and open the breakout rooms from what I had previously? Okay.
Fantastic. Thank you, Zach. How are we doing here? Does it look like most folks have joined the room?
Yeah, it looks like there's a few people who maybe joined after the initial session. I can assign them to a room.
Okay.
Let me go through here.
Oh, someone asked if they're in group 17.
There's a couple folks.
Okay. And it's okay if you end up joining a group that you were in previously, that's okay. The main thing is just to have some interactive dialogue with your group. Actually, are they able to hear me in the breakout room?
No,
Probably
they
not.
can't. They can't hear you in the breakout rooms.
Okay.
But I'm assigning folks to
Okay.
rooms that don't have a number next to them. Again, they probably were not able to join earlier, so they don't have a room.
If I type a message in the chat, does I go to the breakout rooms or no?
So it looks like everyone's been assigned a room
Okay.
now.
I'm just going to remind them about the task, but I'm assuming that they know what to do.
Do you want to broadcast a message to them?
Can I do that just to say, pick one in case? I'm assuming they know, but I was just going to put the instructions, pick one of the strategies.
So yeah, I tell you what, just type in the chat box what you want them to see, and I'll copy and paste it into the breakout room message.
Okay. just to remind them.
Great. I sent it out over the,
Thank you, Zach. Was there a time limit on these groups, or do you just pull them out when we're ready?
you tell me whenever you
Okay.
want them to come out, and I
Okay.
can make sure it happens.
Yeah, I'll probably just give them another 5 minutes, and that should be enough time. And then
Okay.
I will bring them out. This way, I just have a few minutes to call on someone to share.
Sounds
and
good.
then we'll move on.
I'll be right back.
Yep.
Jim, I just gave them a message that said return by 11:30, but
Oh,
we can close them whenever you want.
yeah, I'm just thinking because theoretically I'm supposed to wrap up at noon.
Okay.
Yeah, let's bring them out. Yeah.
Okay.
And thank you, Zach, for facilitating that. All right, so is everyone back? Let's see.
Jim, it looks like we're at about 70 folks. So I think the last couple are trickling in. You can probably start.
Yeah, all right. So let's go ahead and I'll ask for a volunteer. Maybe I could pick a group, maybe to someone from group 9. Someone from group 9 want to share their brainstorming session. Just quickly, what strategy you picked and how you discussed that you could apply it to your teaching environment.
Jim, this is Megan. I was in group 9. We talked about some of the prior knowledge and how to incorporate prior knowledge. So we discussed some of the different strategies that we've seen of cumulative exams or trying to work with other colleagues to create an environment where your cases aren't so siloed with one disease state, and trying to incorporate a more realistic patient into your teaching facilities. We more were focusing, I think, what we'd all kind of just seen, and I don't know that we came up with a great way to include it all in our teaching environment, but we thought we definitely need to. It definitely, hit a bubble with us that, some of the cumulative exams, whether they're high stakes or low stakes, and whether students take ownership of some of those things during the course of their career.
Okay. Yeah, thank you, Megan, for sharing that. Certainly I think that sometimes implementation of these strategies may be challenging based on your role as an instructor. As we talked about, what's your environment? Maybe not everyone has the opportunity to use cumulative exams, for example. But I think one of the key takeaway points is in terms of helping our students is to space out quizzes, and again, these practice quizzes, or spacing them out, having them more frequent, low stakes. I think is certainly something we can do both in the the classroom as well as the experiential setting. Okay, well, thank you for sharing that. We're going to go ahead and move along since I want to be sensitive to time. We have more slides to cover, another breakout session, hopefully. So we'll go ahead and move forward. So another strategy I want to cover is elaboration, also known as elaborative interrogation. So this is a process of giving new material meaning by expressing it in your own words and connecting it to what you already know. So elaboration is considered an effective study method, as many studies have shown. This approach helps students think more in depth and make connections between new learning and prior knowledge. The more you can explain how your new learning relates to your prior knowledge, the stronger that the students will have a grasp on the new learning. The more connections that they will make, and the greater the ability that they'll remember it later on. So enhancing long-term memory. Elaborative interrogation is specifically designed to trigger recall by asking how and why questions, and also finding or answering the questions. So students who learn to extract the key ideas from new material and organize them into what's called a mental model and connect that model to prior knowledge show an advantage in learning complex mastery. A mental model is an explanation or representation of how something works that you carry around in your mind. So mental models are thinking tools that you use to understand new concepts, make decisions, and solve problems. They're used to simplify the complex into understandable organizational chunks. So for example, as we develop mastery of various complex functions and tasks related to PharmD practice, things like taking a medication history, conducting a med reconciliation, our brain tends to bundle together the incremental steps that are required to perform the specific function or task, thus forming a mental model. So examples of applying elaboration include instructing your students to ask themselves how and why questions while studying your material. Students should find the answers to their questions by using your class or instructional materials. It's also a good idea to encourage your students to discuss their answers with their colleagues. Students can develop and answer how and why questions for a specific topic, either independently with you as a facilitator or in groups or pairs of students. Now, it is important to remember that once students produce the questions, they must also find the answers. Now, as students elaborate, they should make connections between different ideas or concepts and explain how they work together, such as mechanism of action and therapeutic use for a specific drug, and think of ways they are related or different. Encourage students to describe how your material applies to their own experiences. So another way for students to give new material meaning and expressing it in their own words and connecting it to what they already know is using visualization tools. So things such as images or mnemonics. I remember back in fourth grade, I had learned the order of operations, right? Parentheses, exponential, multiply, addition, subtraction, and so forth. So the mnemonic that I was taught was, please excuse my dear Aunt Sally. And this was the mnemonic for learning the order of operations. Now, another method is not the method of loci. This is the method of loci. And it's actually the plural form of the word locus, which means location. This is another effective mnemonic device to aid in memory storage and retrieval, which uses visualizations of familiar spatial environments to enhance the recall of information. So the effectiveness of the method of loci relies on visualizing mental images to associate with the material that needs to be remembered. So the more vivid the visual, the more effective the method. So here, an example is that if you're memorizing the steps to use a metered dose inhaler, it is helpful to choose a familiar location with distinctive spaces or rooms for which you will store each step of what you need to memorize in using a metered dose inhaler. So this way, as you mentally walk through your location from room to room, you are better recalling these steps. Now, elaborative interrogation can be a tricky strategy to implement. It can be hard for students to pick out the right information to ask questions about, or even produce how-why questions, because students won't always focus on the right information. So it is important to make sure students have the content knowledge necessary to carry out this task. Key takeaway points is that you as instructors will need to guide students towards the right kinds of questions and give feedback on the explanations. As students elaborate, make connections between different ideas to explain how they work or don't work together. Another strategy is personalization or self-reference effect. And this is a form of elaboration where the to be learned information is related to self. Hence the phrase self-reference effect. As instructors, we've all heard the commonly asked questions from your students. Yeah, but what am I going to use this for? Or what's this have to do with me? So these questions are often asked by students who must take a class or clinical rotation, but initially do not find the content worthy of their time or effort. So when they ask these questions, typically they're not trying to be disruptive, but they're often looking for relevance. Why is this important to me? So learning is stronger when it matters. Personalization provides perceived importance or relevance to the learner. Learning and recalling new information improves when the abstract or theoretical is made concrete and the student is able to relate or connect new knowledge to personal experience. So teaching the relevance of your lecture or any educational activity can help students develop into an engaged, motivated, and self-regulated learner. Now, some examples of applying personalization. I first talk about utility value, which refers to the student's perceived usefulness of the task or activity. Again, why do I need to do this? So research has shown positive connections between utility value and students' motivation, behavior, and achievement. Students who find academic tasks useful for present or future goals are more likely to put forth effort for those academic tasks. So while students may not enjoy an activity, they may value a later reward or outcome it produces. This activity must be integral to their vision of their future or must be instrumental to their pursuit of other goals. Because goals can play a key role in attaining their later outcomes, you as educators should help students see beyond the immediate activity to the long-term benefit it produces. So, answering those questions, why do we have to study this stuff? I get that in village labs in our course. Why do I have to know blood pressure monitoring? Is compounding still relevant? So this slide here outlines some examples of utility value assignments. And I'm not going to go through all of them, but for example, asking a student to reflect on the utility value of a specific topic or scenario by summarizing a topic and explaining how the topic is relevant or useful to their own lives. Some other ways to increase utility value in your educational activities is, again, explaining the purpose of the lesson and assignment, show connections between what's in the classroom and the real world. You can share personal stories about people with whom your students can identify, who use similar knowledge or skills. You can invite community members, preceptors, alumni to share ways in which they use information or skills in your class. Lastly, you could show how classroom activities match the instructional goals of your class. So if you as instructors help students understand the overall goals of the course and how those goals are consistent with their own goals and interests, students may better understand and appreciate the importance. Oi, am I jumping ahead here? Okay. Okay. So the other thing I wanted to mention related is the goals setting. So goals are crucial to academic success, even beyond the classroom. So setting and tracking goals helps your student to learn important life skills such as planning, organization, and time management, while also building communication skills, self-awareness, and competence. So creating and tracking goals is a great way to understand your students' current academic standing and allows you to focus on determining direction of future. How do you make goal setting work? Well, do it often. Short-term goals allow for invited frequent check-ins with students, at least weekly, if not daily. In turn, these check-ins allow for frequent revision of the goals based on student progress. Important to put it in writing, so make it visual. Focus on identifying the goal and the setting, a firm end date for the students. Describe actionable steps to get their goal and evidence that they have reached their goal. So again, allow them to have a reflection or getting feedback. And again, lastly, creating personal relevance. Now, benefits of goal setting, I have them listed on the slide. It has been shown to provide a clear path to success for your students. Teaches time management. Having a clear plan also reduces procrastination, increases motivation, measures progress, and gives focus and purpose. It can also boost self-confidence when your students start making progress toward achieving their goals. It's a big confidence boost and helps them tackle future goals with less anxiety. Okay, another strategy you may have heard of is scaffolding. This is the process of sequencing your instruction towards higher goals. So instructors should start by building on what their learners already know, their prior knowledge, and then add more detail and information and complexity over time. It is best to allow your students to perform on their own. So over subsequent weeks, you can begin the fading process by slowly removing student support in order to give the students more responsibility. Now, an example of using the scaffolding in the classroom setting is breaking up your lecture and educational activities into chunks and breaking down assignments into component pieces, again, increasing the complexity of those assignments over time. Now, for example, in our Abilities Lab courses, we teach writing a SOAP note, the components of a SOAP note, and what data information belongs in each component of the SOAP note. So one option is to break down the SOAP note writing activity into individual assignments where you're emphasizing each component of the SOAP note at different stages, maybe spaced out 1 week apart. And then you put it all together in a final assignment. Now, in our institutional-based lab courses, we do build complexity over time with our inpatient medication order verification activity. For this activity, we use scaffolding by adding new treatment-related variables to the patient's electronic health record each week, making the patient more complex. So for example, in week 1, we introduced medication allergies. Week 2, drug interactions. So maybe concurrent medications the patient's taking. Week 3, poor renal hepatic function and so forth. So again, increasing the complexity, and this can be done even with case-based instruction in other courses. Now, finally, looking at experiential education, the overall structure of a student's experiential rotation should be scaffolded, both between and within rotation, ideally. Students should be exposed to more complex patients over time and have preceptor support reduced over time. So move in from modeling, coaching to facilitator role and allow students more independence. And any of you that have gone through ASHP accreditation for your residency program knows what I'm talking about. But this approach will support students' metacognitive development. And this scaffolding, a progressive problem-solving approach, is a critical part of developing expertise in our students. This process of gaining expertise is just as important as gaining knowledge and skills. This slide is showing some scaffolding strategies that you can use, show and tell. So every chance you have, show or demonstrate to students exactly what they're expected to do. Tap into prior knowledge, launching the learning in your classroom from prior knowledge of your students and using this as a framework for future lessons is not only a scaffolding technique, but many would agree is just plain good teaching. Give time to talk. All learners need time to process new ideas and information. So for example, weave in think, pair, share, turn and talk, or some other structured talking time throughout the lesson. Pre-teach vocabulary. Introduce complex medication names, medical terminology, adverse effects using analogies, metaphors, images. Use visual aid, again, pictures, charts. Graphic organizers are very specific in that they help students visually represent their ideas, organize them, and grasp concepts. We can use this pause, ask questions, pause again, review. So this is a great way to check for understanding while students read a chunk of difficult text or learn a new concept. And we can share that new idea from a discussion or a reading, and then we can pause, provide think time, and then we can ask a strategic question, pause again. And then you can design questions ahead of time to make sure that they're specific, guiding, and open-ended. But it's a great way to keep students engaged as active listeners. Another strategy, distinctiveness or distinctive processing, is a process of is the processing of difference in the context of similarity. So research has shown that near perfect memory for a substantial amount of material following such processing. Moreover, distinctive processing has been shown to reduce forgetting as well as false memory. Pre-existing knowledge enhances memory by facilitating distinctive processing to identify similarities and differences. Research has also shown that thinking of differences between two similar things should be easier than thinking about differences between two different things. So this is counterintuitive prediction has been confirmed by studies showing that people generate more higher quality differences for pairs of similar items. So for example, beer and wine versus different items, beer and dogs. So this finding matches data showing better memory following the combined processing of similarity and difference than following the processing of either one alone. So this slide outlines some examples and application of distinctiveness. Includes asking your students to compare and contrast. For example, asking students to point out the similarities and differences in toxicities for paclitaxel and docetaxel. They could use a minute paper, which is in the classroom, which is a type of assessment technique. It really does take about a minute and usually is used at the end of class, but can be used at the end of any topic discussion. The major advantage is that it provides rapid feedback on whether the instructor's main idea and what the students perceived as a main idea are the same. We also have Venn diagrams, which help to visually represent the similarities and differences between two concepts. A Venn diagram is a graphic organizer consisting of two or more overlapping circles. Most of you are probably familiar with this, have seen these, but it's used to compare and contrast information. So this slide here is an example of a Venn diagram visually representing the similarities and differences in toxicities between paclitaxel and docetaxel. We can see the circles that overlap have a commonality, while circles that do not overlap do not share those traits. Final strategy is peer teaching, which we will get to in a minute. Boy, the day is getting long already. Before we move to peer teaching, I just have this slide is just really depicting an example of a minute paper. So as mentioned earlier, it is a feedback tool that gives students a chance to self-reflect on where they are in the learning process. So at the end of the class or instructional time, give students 1 minute to answer 2 or 3 questions. This slide is showing you some examples of questions. What was most important that you learned in class today, or list key concepts. So give them that 1 minute to respond to those questions. You can collect the anonymous papers, look them over and report back to the class during the next session. So it is very important that you report back, reinforce the main points from the previous class, and clear up any misconceptions. Okay, finally, peer teaching. This is a student-centered design where the student takes an active role as both the teacher and the learner. This approach reinforces confidence, communication, and presentation skills among your students, and instills a culture of learning and teaching that includes open discussion on areas of difficulty and increases enthusiasm for learning. The value of teaching others is highlighted in this picture of the learning pyramid. Some of you may have seen the learning pyramid. But as we move from the top of the pyramid, from passive learning activities to the bottom, where we see active learning activities, we can see that teaching others, which is an example of a higher level of active learning, is associated with a 90% average learner retention rate after 24 hours. Examples of active learning approaches that make use of peer teaching include team-based learning. We just had a great session on that. Again, it's a structured form of small group learning that emphasizes student preparation out of class and application of knowledge in class. We also have the pecha-kucha. This is a Japanese word that means sound of conversation or chit-chat. This format was developed by a Tokyo firm to give young designers a place to meet and show their work and exchange ideas in a 6-minute, 40-second presentation of 400 seconds. A pecha, see, no, I can't even say anymore. Pecha-kucha presentation, so again, is a format that uses 20 slides or images that are displayed for 20 seconds each. The slides move automatically as the presenter is speaking. This format ensures the speaker is concise, keeps the presentation moving, and gets through all the content, kind of like what I'm trying to do now. So although it is an uncommon format, it is most often used for professionals to share a journey or story. Now, some of you may have also heard of this jigsaw discussion. It's a cooperative multi-step learning strategy that makes use of home groups and expert groups. So students meet with members from other home groups who are assigned the same topic. And by doing so, they form an expert group. After mastering the material in the expert group, each student returns back to their respective home group and teaches the material to the group members. So the jigsaw exercise helps to build students' comprehension. It does encourage cooperative learning and improves listening, communication, and problem-solving skills. Finally, a fishbowl, something that we do extensively at the School of Pharmacy, fishbowl discussion. Students seated inside the fishbowl actively participate in discussion by asking questions, sharing their opinions, while students standing outside listen carefully to the ideas being presented. So in our curriculum, as I mentioned at the school pharmacy, we currently use fishbowls with standardized patients to expose students to real world scenarios related to pharmacy practice, things like communicating medication errors, discussing an ethical dilemma, providing education to a complex patient. So the standardized patient or actor interacts with the student in the inner circle or group A, and then the remaining students are observers in group B or the outer circle. Now, alternatively, you can set up the fishbowl so that 2 or more students are having a discussion in the inner circle, and then you have students on the outside that are active listeners. So why do this? Why do fishbowls? The instructor, you as the instructor, want to give students a reason to speak and others to practice active listening. That's really the big benefits of doing this. Fishbowls also require students to retrieve and apply their knowledge. Students are given an opportunity to articulate a point of view. The process deepens students' understanding of a topic in relation to other perspectives. And finally, it does provide an opportunity for students to practice and observe conversational approaches that they need to master, such as backing up assertions with evidence, or asking follow-up questions, paraphrasing, or elaborating on another student's point of view. Okay, I want you to take about 5 minutes now. Let's just go ahead and break out into our same groups and pick a strategy that's been recently presented here, and discuss how you're going to use this strategy in your teaching environment. So let's go ahead, take 5 minutes, and then we'll jump back in to wrap up.
I opened up the rooms, Jim.
All right, thank you. So I'll go ahead and join your previous room, take 5 minutes, have a little powwow, and then we'll jump back.
Jim, I'll close the breakout rooms in a minute.
Sorry, thank you. I was unmuted.
You're fine. All right, breakout rooms are closed. They'll have about 60 seconds to come back over.
Right.
You're good, Jim.
All right, well, welcome back, everyone. So just in the, to just be sensitive to the time, I'm not gonna ask for a volunteer to share. So Manny, you're off the hook. So we'll go ahead and wrap this up with my final slide, if I can get there. There we go. So really, some useful tips to keep in mind is, don't try to implement all the strategies all at once or all at the same time. I think it's important to start with small changes and see how it goes. Plus, also, again, depending on your learning environment, depending on your audience, your students, you may find that some strategies work better than others. But again, scaffolding, you can make little changes with each iteration of your educational session. It is important to explain to students how learning works. So remember, when learning is easy, it is often superficial and soon forgotten. When learning is effortful, it changes the brain and increases intellectual ability. Teach students how to study. Rereading, mass practice, and cramming are far from optimal. Explain to your students about the evidence-based learning strategies discussed today, such as retrieval and spaced practice, and how these strategies enhance long-term memory. You want to create desirable difficulties. Some kinds of difficulties during learning help to make the learning stronger and better remembered. So use frequent quizzing to help students consolidate learning and interrupt the process of forgetting. Make sure quizzes are easy, quick, predictable, and low stakes. Finally, be transparent. Being upfront about some of the frustrations and difficulties these learning strategies entail, but also why they're still worthwhile to use. Okay, so that's ends my my presentation today. I want to thank you all for your participation. Again, you know how to contact me if you do have questions about this presentation. Again, a recording will be made available, so this way you can view that at a later time if you choose to do that. I'll go ahead and stop sharing. So now it is 12 o'clock, and according to the agenda, we have a 1-hour lunch break. We're going to come back at 1 p.m. Dr. Sandeep Dev will introduce our afternoon speakers that we have scheduled this afternoon, and I think that's a wrap. So again, enjoy your lunch, and we'll see you guys this afternoon.